So FUE transplants, the name refers to follicular unit extraction, and hair grows not just in a random pattern, but hair follicles are actually clustered. Microscopically, you'll see, 2, 3, 4 hair follicles all very close together. They're so close together that a very tiny punch of skin graft that can be only 1 millimeter or less in diameter can actually convey that cluster of hair follicles to where you want to put it. So the hair which is never lost, which tends to be in the back part of the scalp, some of that is used, repurposed, and transplanted to where it is needed, which is basically more in the front or frontal area or in the crown or top of the scalp. So FUE is very reliable. A lot of the non-surgical treatments, the medical treatments for hair loss, can vary quite widely from person to person, just for genetic reasons that they tend to work better in one person than they might in another. FUE is pretty reliable because those hair follicles are simply being moved from point A to point B. And you can't predict for just about everybody that they're going to get some substantial improvement from FUE. Hair grafts are so tiny that there's very little of a wound created, both in the donor area in the back of the scalp or in the recipient area where the grafts are placed. Because they are so small, they heal very, very quickly. Most of the time, just within a few days, these sites will heal and will look pretty presentable. The more grafts done, the more effective or obvious the improvement. Traditionally, graft numbers of like 1,000 grafts or even up to 2,000 were considered pretty large cases. That's a long procedure and it takes a lot of technical expertise. With that degree of grafting, you can get a even more dramatic improvement with one treatment. There are some effective non-surgical treatments for thinning hair, and we're referring mainly to male pattern hair loss. So one treatment that is pretty effective is finasteride. This can restore some of the tiny hairs that are no longer even visible but are still present to just make them grow and become more visible. Another treatment that is pretty effective is minoxidil in an oral form, not the Rogaine that is used topically, but a very low dose, frequently less than 1 milligram a day of minoxidil can give a pretty impressive improvement in pattern hair loss. PRP, or platelet-rich plasma, is a treatment that is also quite effective, and that involves taking the plasma from the patient. So it has to be a blood sample. It's processed to enrich for platelets, which are little cells that have a lot of growth factors. And the PRP is then injected directly into the scalp. These are pretty effective. However, the big drawback is that they are not permanent. So even if they work really well, if those treatments are stopped, the hair you'll lose the hair and kind of revert to where you would have been had you never been treated. The big advantage of FUE, or follicular unit extraction hair transplants, is very quick recovery, no scarring or virtually no scarring. Because the grafts themselves are so tiny, 1 millimeter or less, the donor area, which tends to be the back or occipital part of the scalp, will heal incredibly fast, usually within 2 or 3 days. In contrast, the more conventional approach where a strip of skin is actually surgically excised will leave scarring, and scarring usually lacks hair follicles, so there will be a more visible evidence of having had a donor tissue taken. Also, because those grafts in the FUE are so small, they heal equally fast in the recipient area and also with minimal, if any, visible scarring.